Hi, my name is Dr. Mark Romeo, and we're going to be talking about PMS on this video, which stands for Premenstrual Syndrome. PMS is caused by change in hormones, which causes anti-inflammatory agents within an individual's body to become pro-inflammatory. And those pro-inflammatory agents cause pain. Not only does it cause the body to be achy, it also causes the uterus muscle to start to contract, which is what causes cramps. And one of the ways you can counteract that is by simply taking fish oil. Fish oil will reduce the inflammation in the body, and it will help knock out pain, knock out some cramping, and decrease an individual's irritability. One of the other things that PMS does is it actually changes, because it changes hormones, it changes blood flow patterns within the brain. And I spoke about this on a previous video, but what happens is that the hormones change, which changes blood flow patterns within the brain, which changes a person's behavior. Here is a picture from the Amen Clinic of an individual where their brain was scanned when she was not menstruating, and what we see is this smooth outer surface of her brain, of her cerebral cortex. And that cerebral cortex for us humans is very important. It's where we appreciate language and art, and it's who we are. The second picture we're looking at is when this individual was experiencing extreme rage, fluctuations in her mood, and a lot of body pain. And she was scanned a second time. And what you see here is you see these kind of holes in what's called the frontal cortex. Now those aren't really holes. The brain's still there, the brain still works. It's just that the blood flow utilization to those cells has decreased so much that the computer, when it generated that picture, put it as a black hole. And what it means is that the neurons that are there are not working up to their normal level. And this is why we see extreme changes in mood, specifically in depression, because that frontal portion of our brain helps us feel good. And when you're not getting the blood flow there, it makes you depressed or feeling low. And that's what was happening to this patient that we're looking at. Here's a second picture of the same individual from the bottom side. So the camera's taking a picture up. Just imagine that. We've taken the person's brain and we've rotated it like this, and you're looking on the bottom side. The first picture I should have pointed out is where you're looking at the top portion of the brain. Anyway, in this picture we're looking up, and what you see is these smoother areas. You still see a little bit of not 100% smoothness on the bottom. And then we see the second picture where you see these kind of extreme changes. And that's the same person. So her hormones, when they're out of control when she's menstruating, changes how her brain utilizes blood, utilizes glucose and oxygen to get the neurons to work. This is what's happening with PMS, is that you're having a change in behavior because the chemistry is being altered because of the monthly cycle. And there are some really easy ways and certain supplements you can take to really reduce inflammation, to reduce the irritability, to get the blood flow to the brain to be normal, so a woman doesn't experience such extreme fluctuations in mood. My name is Dr. Mark Romeo. This video is done for the San Buenaventura Family Wellness Clinic. Thank you.